Thank you, Mary Jo. I really appreciate you having me here today to speak with everyone. I'd also like to thank the New Jersey Immunization Network, the New Jersey chapter of the American Academy of Pediatrics, and all the other sponsors for organizing this event. I'm happy to be here today to share my story with you in order to raise awareness about HPV-related cancer. At this point, HPV-related cancer is being called an epidemic by experts in the field. Younger and younger people are getting it, some as early as their late teens, 20s, and 30s. Until about a year and a half ago, I was in good health for a woman in her early 30s. I exercised regularly, ate a healthy diet, maintained good weight, never smoked, rarely drank, and made stress reduction a priority. I may appear to be in good health at this time, but I faced many health challenges in the past year and a half that I hope someday no one will have to go through. Just over a year ago, at the beginning of November 2013, I had a slight sore throat that wouldn't go away. It was not especially painful, but it was odd because it felt sore in one specific area of my throat I could pretty much point to with one finger. Food seemed to get caught and pull a bit when I swallowed. I figured it was a virus or maybe strep. When it didn't go away after a week and a half, I went to see my PCP. He couldn't see anything, and the strep test came back negative, so he sent me to an ENT just to make sure, who saw me the next day. He scoped me to look down my throat, and he said he saw a small ulcer that was probably nothing, but he wanted to order imaging and do a biopsy just to make sure. I didn't really think much of it because he said it should be nothing and didn't seem concerned. I got an MRI soon after and went to pick up the report when it was ready. I started reading the report while leaving the imaging center. My heart stopped and my mind went blank. At the bottom of the report it said, probable squamous cell carcinoma. I called my ENT right away, and he confirmed that seemed to be true. Only the biopsy scheduled a few days later to confirm it. The biopsy did confirm the diagnosis. Stage 4, squamous cell carcinoma with potential lymph node involvement. I cried when the doctor told me, but at the same time, I could not understand how what he was saying could be true. People my age are not supposed to get cancer. The biopsy also revealed that it was caused by the HPV virus. HPV sounded vaguely familiar to me. I was aware it could cause cervical cancer and that there was a vaccine for it that came out around the time I was 25. I had no idea that it could also cause head and neck cancer. All the doctors kept telling me how rare my type of cancer is for women, especially young women. That month was a blur as my husband and I saw doctor after doctor and tried to decide what treatment option would be best. The local doctors all said radiation chemo was the only option. However, when I went to see ENT surgeons at the larger, more specialized hospitals, all three of them told us the tumor was operable under a new technology called TORS, which is a robot-assisted surgery that allows surgeons to operate on tumors that were previously inoperable. I decided to have the surgeries, which included a neck dissection on the left to remove the lymph nodes, followed by the TORS tumor resection a few days later. After the surgery, I was in the ICU a few days due to the bleed rest from the surgery, and then on a regular floor for a total of a week. I had to relearn how to eat and how to talk. I ate through a feeding tube the first week, and then transitioned to pureed foods, gradually increasing the texture over the next few weeks at home until I could eat solid foods again about a month later. My speech was garbled and barely intelligible at first. As I did the voice exercises multiple times a day, it very slowly improved. The pain was intense and the exercises frustrating, but I was determined to work hard towards regaining functioning. My surgeons were able to remove the whole solid tumor, but it had already started to spread across the tongue through the nerves and capillaries, So after a month of recovery from the surgery, I started round 2, chemo and radiation. Luckily, the center where I was treated had proton therapy radiation, a new treatment with less radiation scatter, and therefore less significant side effects than other radiation treatments. We fought my insurance to get it covered, and it was finally approved. As I did the treatments, I had increasing pain in my mouth and throat that made it more and more difficult to eat. Soon I was back to eating only soft and pureed foods. Every bite and swallow was torture, even with heavy medications. My side effects got so intense by the time I finished that I ended up in the hospital for a few days. I finally went home to recover for about a month when I was able to return to work part-time. It was another month before I could go back to work full-time. Once I was home, I worked hard in physical therapy to regain my strength and in speech therapy to continue and improve my swallowing and speech. I was very lucky that my speech and swallowing were minimally affected by my treatment. Many people have permanent speech impediments and swallowing difficulties after the surgery and treatment that I had. My cancer journey continues with ongoing scans, doctor visits, and research into promising clinical trials to prevent recurrence. I'm thankful to be here, but I live every day with the fear that this monster that has caused me so much pain and suffering could come back. I am committed to educating healthcare professionals like yourselves and parents about the simple HPV vaccine that children can get around age 10 or 11 that has the potential to save them from this horror that I've lived through. In addition, I encourage preventative screening through annual physicals, OB/GYN exams when appropriate, and medically recommended testing. And if anyone ever has a lingering health issue that will not go away of any sort, I encourage them to see a doctor as soon as possible, because you never know. It's probably nothing, but it definitely could be something you never even thought of. I ask that you please share my message with colleagues who could not join us today, and with the parents that you speak with daily. Even if it prevents only one child from getting cancer, that one child's life and future is certainly